Hey, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD 22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
Synovetin OA was the first of its kind to be studied in canine osteoarthritis to show efficacy for 12 months.
Welcome to Petability. I'm your host, Kathy Simons, certified veterinary technician, certified canine rehabilitation practitioner, and certified hospice and palliative care technician for pets.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Hey, Kathy, how are you?
Hey, Chris, what's going on over there today?
It is raining cats and dogs over here all day long.
Same here, Chris. It has been raining all day very heavily, and I can tell you that the osteoarthritis in my knees are telling me it's going to rain for a while.
This is a doozy, huh?
Yeah, this is a doozy.
Well, it's interesting that we're talking about osteoarthritis for ourselves, because on today's episode of Petability, we will be speaking with Dr. Matthew Brunke about a novel, long-lasting, groundbreaking treatment option for dogs with osteoarthritis, or OA, called Synovetin OA. You know, I was recently with some friends, and one of them asked me if all animals can get arthritis. And I certainly don't know about all species, but we certainly know that it exists in dogs, cats, horses, birds, farm animals, zoo animals, and other exotics. The most important thing to know about osteoarthritis in dogs is that it's a chronic, progressive joint disease that causes pain, inflammation, and reduced mobility. In fact, 80% of dogs have OA by the time they are 8 years old. And dogs are living to be 14, 15 years old or longer these days with all the advances in veterinary medicine. So early detection and proactive management are key to slowing down its progression and maintaining a good quality of life for your dog.
Osteoarthritis is so prevalent in our patients that we see. And if you have ever experienced achy, swollen, stiff joints, then you know what osteoarthritis feels like. You might even be able to predict when it's going to rain based on your discomfort level, as I alluded to earlier. But osteoarthritis is very common, and it's a predominant factor in reduced mobility in our pets. Osteoarthritis can be subtle at first. You might see your pet have some decreased activity, some stiffness after resting, maybe a reluctance to jump in or out of the car or climb stairs. Osteoarthritis is not just a senior dog issue. It can affect younger dogs, especially those with joint abnormalities like elbow dysplasia. And finally, there is no cure for osteoarthritis, but it can be managed with a combination of weight management, joint supplements, medication, physical rehabilitation, or regenerative therapies, and advanced treatments like Synovetin OA. And our guest today is a very experienced in using this unique and advanced therapy for dogs in his care that many are calling a game changer in the field of veterinary medicine.
So before we get into all of the ins and outs of Synovetin OA, I want to tell you a little bit more about Dr. Brunke. He is a diplomat of the American College of Veterinary Sports Medicine and Rehabilitation and a fellow in the International Association of Veterinary Rehabilitation and Physical Therapy. He received his DVM from Ross University School of Veterinary Medicine in St. Kitts. He is certified in rehabilitation, pain management, acupuncture, and manual therapy. As a sports medicine and rehab specialist, his focus is on diagnosing complex mobility problems, both orthopedic and neurologic. He utilizes injectable therapy for treating tendon and ligament problems, managing arthritis, and for neurological problems like lumbosacral disease. He especially enjoys working with active duty and retired working canines. Dr. Brunke is part of the founding faculty for the Northeast Seminar's NC State CCAT rehab program. He practices at Veterinary Referral Associates in Gaithersburg, Maryland. Welcome to the show.
Welcome to the show, Dr. Brunke.
Thank you both for having me. It's a pleasure to be with you.
So I'm sure our audience is very eager to know, what is the Synovetin OA? What's it all about?
Synovetin OA was the first of its kind to be studied in canine osteoarthritis to show efficacy for 12 months. So when we talk about like regenerative therapies or having to stay on oral meds every day of our life, like, you know, how can we reduce those things? And other research trials showed other treatments like intra-articular cortisone or PRP or things like that, or even stem cells probably will work for 3 to maybe 9 months. But Synovetin was the first of its kind to show efficacy for 12 full months in multiple clinical trials. But what is it? It's actually a medical radionuclide. So it's a radioactive isotope tailored specifically for treating arthritis. The concept of using isotopes to treat OA comes from Europe, where thousands of patients, human patients, get it every year for the last 20, 25 years. And they've been able to avoid, in some cases, sending those patients for total knee replacements or other total joint replacements, which is great. If your patient can be comfortable from a single injection and last multiple years, then that's great.
That is a fair amount of time. That's really exciting to hear, especially for some of my senior patients and getting that long-lasting relief. But when I hear you talk, as I'm thinking as a layperson, when I hear you say radioactive isotope, I go, oh no, radiation, that seems like it's bad. But what I'd like the audience to know is we've been using radioactive isotopes in veterinary medicine for a long time, treating a multitude of conditions. And probably the most common is using I-131 to treat hyperthyroid cats. So we have been using radioactive isotopes in veterinary medicine for quite some time and very safely.
When we think about radioactivity, we think we're going to create Godzilla. We're going to, we're creating damage. We're not thinking about the good things that we can do with radioactivity. So targeting radioisotopes for specific conditions is really important. And these things all get studied on a level so high before they can even be approved for use. So the safety is so really there because it's not going to get approved if it's not proven to be safe. Now with cats, for I-131, the most common patient we're going to use that on is cats with hyperthyroidism. So we give that injection of I-131 under the skin. It goes into their thyroid, eliminates the excessive thyroid tissue that's there. The dose is calculated very carefully. And then that cat has to stay in the hospital for at least 5 days or longer because the isotope also gets into their urine, their feces. So there's some management stuff. But again, cats can do exceptionally well with that, and it's often a cure for their hyperthyroidism. With Synovetin, the isotope doesn't leave the elbow joint. So it gets injected by me or other veterinarians directly into the problematic joint, and it stays there. And what it does is it shaves back the overgrown synovium. The synovium is the joint capsule lining. It's what provides the nutrition to the joint. And when it's inflamed and overgrown, it's creating arthritic, painful joint. So the isotope goes in, it shaves it back because the cells eat up the isotope and then just kills off those cells very carefully, very calculated wise. But the isotope doesn't get into their pee or their poop. So these dogs get to go home the same day. And yeah, they have some minor restrictions. The biggest one is you usually can't sleep in bed with your dog for about 2 weeks. But otherwise, they have completely normal lifestyles. And improvement is seen in the first 2 weeks up until 3 months and can last for up to a year or maybe even more.
I understand it's injected into the affected joint. It stays there versus being systemic throughout the dog's body. So, and as you said, they're not going to glow in the dark or anything like that afterwards. Yep. But I'm a little confused on what it is doing exactly within the joint. I know it's called Synovetin because you said it affects the synovium.
If we're going to use Synovetin, and we first have to confirm our diagnosis. We have to know specifically that we're dealing with arthritis and that we're not dealing with something, gosh forbid, cancerous or infectious or things that might really need surgery, right? Like if there's a fractured bone, Synovetin's not what we're reaching for. So what happens is you go, you see your veterinarian, they figure that out ahead of time, they get the diagnosis, they get the x-rays or maybe a CAT scan to confirm what's going on, and then we order the Synovetin. Because it's not something you just keep on the shelf because it is radioactive. And we'll talk about decay in a bit as well and how that's really important. Once the team, the veterinarian, the pet owner, everybody involved has agreed that Synovetin's the right thing for this patient, order it in, they get sedated that day, the veterinarian puts a needle directly into the problematic joint, pulls out that worn out joint fluid, and then injects the Synovetin directly into that joint. And then over the course of several weeks to months, the isotope, which is an isotope of the metal tin, like the Wizard of Oz, the Tin Man and the Wizard of Oz, right? So it's an isotope of tin, and that goes in, and the cells inside the joint capsule, inside the synovium, are overgrown. And if you think about it, it kind of looks like a big sea anemone, right? It's just this thing that's kind of floating around. It's way too thick and inflamed. And those cells pick up the isotope, and that those cells then die themselves, right? Because the isotope just kills them. But it's a controlled, very specific dosing. We're not eliminating the entire joint capsule. We're not shaving back just too little. It's finding the exact right dose to shave that back. So those cells die. The body takes them and pulls them through the bloodstream and pees them out, and does the same thing with the isotope. Synovetin's half-life is 14 days. So that means that if I inject it on the first of the month, 100% of it is there on the first of the month. 50% of it is inactive and eliminated through the urine on day 14, so 2 weeks later. And the same thing. So 2 weeks after that, we're down to 25% of what we originally put in. So in the first month to 6 weeks, the most significant amount of shaving back that joint capsule is when that occurs.
Even though it's excreted in their urine, the urine is safe.
Correct. The thing is that the molecule of Synovetin is large enough that it cannot pass through the joint capsule all by itself. The only thing that can move it outside of the joint is a white blood cell. So our lymphocytes. And the thing is that the lymphocytes, when they engulf the Synovetin, they also wither, right? They don't live through that. But once the Synovetin is inactive, so that 14 days, now those white blood cells pick that inactive Synovetin up. They go, okay, you shouldn't be here anymore. They pass freely through the joint capsule back into the circulation, and then it just gets peed out. but it's entirely inactive.
If I was a client and we were talking about this in the office, my thought process might be, okay, inflammation. How would this compare to just treating my pet with a nonsteroidal anti-inflammatory drug?
Let's try to keep it as a simple case, right? Let's say it's a 10-year-old Labrador who has elbow arthritis in both elbows, right? Because that's the most common form, right? We know that elbow arthritis occurs bilaterally 65% of the time. So we've had a dog who they got diagnosed early in life. They probably had surgery. They did arthroscopy. They tried to control what they could control, right? And help that patient a lot. And now this dog is 10 years old. It's fat. It doesn't walk that much, but it limps a lot. And the pet is brought in to the veterinarian going, my pet limps a lot. So hopefully they get some x-rays to confirm it. They really should, right? And they get put on maybe a joint supplement and a non-steroidal, let's say carprofen. Now that dog's taking pills all the time. Is it still walking? Maybe it gets some relief, but they're not walking it as much. They're trying to walk it. They're trying to get it to lose weight, but those can be challenging. But that dog has to take those pills every day. And so, yes, those medications are entirely safe. They're FDA approved. But what happens when that patient throws up and can't, right, or has an ulcer from that medication, which is an unfortunate once in a while side effect? Now that patient can't take that medication. Or the patient was like a C minus before, and maybe with the carprofen, it got up to a C plus. But they come back into your care team as a veterinary team and they turn to the techs and they go, well, my dog couldn't walk half a block and now the pills make him walk 2 blocks, but he can't join the family and like going to the ball game and going to here and there. Like he's really painful. So those are the times we're really thinking like, gee, if only 1 or 2 joints are affected, or even 3 joints are affected, why are we challenging this patient with systemic medications that are maybe only getting us to a C plus, B minus? So those are the ones I start going, can we inject something directly into the area? My favorite thing with that is whether it's some sort of targeted approach. And in rehab, that may be laser therapy or shockwave therapy, absolutely. But maybe it's in the sports medicine world, it's more the joint injections. Because arthritis is a chronic inflammatory condition. So you have to take those anti-inflammatories every day because the carprofen gets peed out of their body in 12 to 24 hours. So that's why you have to take it every day. So why not inject something directly into the joint to be a targeted anti-inflammatory? Right? That's what we're doing with the Synovetin is I keep saying shaving back the joint capsule, but it's reducing the inflammation. And if we do that, now that's something that's in there all the time, doing that at a much more potent level. Now we can actually see that dog can have a better range of motion, be more comfortable, walk further. Now it's going to be hopefully easier to get that buy-in to start talking about getting that dog to lose weight, build muscle. And so now we have something that we have a better patient and a better outcome.
As you're talking, I'm thinking to myself, I know that lab. I know I've seen them a million times. But also, what the course seems to be, we'll start that carprofen. And then when the carprofen's like the dog's not doing as well, then we have to pile on more things, gabapentin, amantadine. So we just add, I think more and more medication to the list to see if we can get the dog to feel better. So it makes sense to me that we could do this with an injection right into the joint and eliminate the need for so many medications.
And I use a letter scale just because I think everybody can relate to it. Do you want your dog floating around a C minus to C plus? Maybe that's some outcomes for some folks, and that's okay. And maybe you get a little bit higher. I'm not saying all dogs on carprofen don't get up to like a B, but if they're in that chronic older dog, fat dog problem, right? They're lingering at that level, right? Because that joint is so diseased. It's been inflamed for 10 years. It's harder. And this is why I'm talking about obesity too, like fat obviously weighs them down because they're putting more pressure on their joints. But fat actually also releases tiny little enzymes called adipokines. And those adipokines cause more joint damage. So even when the dog's laying in its dog bed, if it's fat, that fat is working microscopically to accelerate the joint disease. that is arthritis.
Even if the fat isn't inside the joint?
Correct. And that holds true not only for dogs, cats, horses, but also humans. And that's why obesity is such an epidemic and such a problem for mobility. So if you think about it, we're all kind of familiar with our normal skin layers, right? We know we shed skin cells every day of our lives, right? If you go to the beach and you get a tan, it gets a little too tan, you peel. And if you peel them off too fast, you're red underneath and raw. But there's the normal balance of shedding cells and growing new ones on your skin. That same rule applies to the joint. So there's normal cell turnover for the synovium, for the cartilage cells, for everything inside the joint. And it's the joint that makes the joint capsule and the synovium make the joint fluid. So that's what creates the lubrication. So now, if we don't keep that balance between destroying cells and having new ones ready to come out to replace those dying cells, we get out of balance like a teeter-totter. And we have way too much destruction and not enough production. And that's what chronic arthritis is.
So, in summary, oral medications and supplements are, again, systemic and have more potential side effects because they're floating throughout our body. The Synovetin OA is more targeted, which I love that. And then when compared to regenerative therapies like PRP and stem cells, you said earlier it's longer lasting, and the Synovetin requires less frequent visits.
Correct. I'm a researcher, I'm a veterinarian. I keep track of a lot of data points. I inject over 450 joints a year, every year, going back at least the last 5 years. 90% of those are dogs. 80+% of the joints I inject are elbows, okay? Because we don't have a good cure for elbow disease. But the average age of the dog I inject is 10 and a half years old. So these dogs have been battling arthritis. Like I'll flip through primary care records and they're like, year after year, carprofen, joint supplement, carprofen, joint supplement. And so it's raising awareness. It's not just that we have good treatment options. It's getting the awareness to get to people like me and my colleagues, whether they're other sports medicine specialists or things like that. What options do we have? Because by the time they get to me, that joint is end stage. So we're just trying to battle it as much as we can. But yeah, I'm trying to find something that is targeted and long lasting. And in some cases, yeah, there's good evidence for some types of PRP. There's good evidence for other things, but maybe not as long. But we always need more studies. And if we think about hip dysplasia, I don't inject that many hips because most of the hips I see are either mild or they're so severe that I'll send them to one of my colleagues who does hip replacements. Because we've been able to do hip replacements in dogs for 20 plus years now. And now we can even do them in cats. So I will oftentimes say, hey, go get your hip replaced because you're a 5-year-old dog. Do you want me to inject you every year? Or do you want us to go get it cured? Up until 2 or 3 years ago, we didn't have that for elbows. But now, just on the cusp, and we'll see where it is in the next 5 to 10 years, there's very few people that can do it, but there are now the opportunity to replace an elbow if we've failed all of these other treatments. It's a newer field, but that's very few things we get to cure in vet med.
I would say as a rehab practitioner, I think the elbow is the most complicated joint. And there's absolutely no way for me to get a dog to rest their elbow. So if I had osteoarthritis on my elbow, maybe I just wouldn't play tennis. But if your dog has osteoarthritis in their elbow, it affects every single movement, function, daily activities that they do all day long.
For us, like you said, we stopped playing tennis, but like dogs have to walk on their elbow. So I actually don't care if the dog flexes its elbow that much. What I care about is when the dog extends its elbow. Like, so if I can gain 10 degrees, if I can gain 5 degrees, that dog can extend that elbow more. That dog now engages its triceps muscle more. And that's how that dog can stand. So think about it for people. Like, it's really hard for you to do a push-up or a plank if your elbow hurts. And that's what a dog walks around on every day when they have elbow dysplasia in OA.
I think that analogy is wonderful. And I tell people that dogs need to engage their triceps for everything. So whether they're sitting, standing, walking, running, jumping, they need to be able to engage that triceps to control their momentum, support their skeleton in a weight-bearing position.
Just standing, they're putting 60% of their body weight on the front, just standing alone.
When they're healthy.
Right. And then they shift weight to the back, their posture stinks. So that's where the head bob comes from. They don't want to put all that weight on, so they throw it up because their elbow hurts. And so that's what I look at like the most, like to nerd out here as rehab practitioners. We all do goniometry. The moment that elbow is not gaining extension anymore, you have to find a new thing. Otherwise, you're not going to win.
Well, and I know in people coming from doing physical therapy with humans, the elbow is the hardest joint to restore range of motion once it's lost. And I think that's true for our pets or our dogs as well, right?
Correct. And if you look at the human radioisotope studies done in Europe, we're all total knee candidates. So like the human knee is the equivalent of the dog elbow. That's why all the human knee studies get done. Like humans have hip dysplasia, but not nearly as bad. But they jack up their knees to oblivion. And they don't want to replace your knee when you're 40 because they know they're going to have to replace it again when you're 65. And your complications go through the roof on your second joint replacement. So that's why they're always staving you off with HA injections in the States or cortisone. Like there's studies in humans, total knee candidates in humans with different isotopes because of the size of the knee and all that type of stuff. In a couple of studies, they're showing 75% of people are still comfortable 8 years after a single injection of an isotope.
Wow. So from what I've read, Dr. Brunke, it seems that Synovetin OA is definitely used in dogs, but has it been used in cats or other exotics? We mentioned the prevalence in the introduction of this podcast across species, but I don't know if it can indeed be used in other species besides dogs.
And that's a really good question. So first off, it was studied specifically in dog elbows. That's where all the research is. When I first got my license, because you have to have a special license to be able to use radioactive materials, my license was specifically for dogs and just the elbow joint. But then we wound up getting an amendment to that license about 6 months later, and I could do any species and any joint that wasn't a human. The state was fairly specific. So I've injected 3 cats, all of them with bilateral elbow arthritis. And cats, they all did really well. They all cats can't take as many meds. Cats have other medical conditions that really preclude them from taking meds, or we all know cats don't like to take meds. So to me, those cats did really well. I would love to treat more cats. And I've been lucky enough, he has since passed, but Murphy, the Komodo dragon at the Smithsonian National Zoo, suffered from really severe knee and elbow arthritis. And several years ago, in a combination effort between the vet team at the zoo and my team in the DC area, we injected Murphy's right elbow and both of his knees. And we were able to get him off of his oral medications, up and about, moving better. And it lasted for almost 15 to 16 months. Wow. So that was a really great outcome, especially if he was a geriatric animal at the time, but he really did really well. So yeah, I've used it in other species. I've mostly used it when I use it in dogs, and most of that is going to be elbows. I've injected over 125 dogs, and it's over 200 joints, and 95% of that is elbows. I've done a few shoulders, a few hips, a few ankles, but most of this has really been how battling this disease that is elbow arthritis.
And you mentioned earlier that they tend to come to you in the later stages of osteoarthritis, maybe when other interventions have failed. So is it actually better to address this earlier with Synovetin OA, or is it more appropriate in the moderate to severe stages?
And that's another great question, right? Like we need to do better about being proactive instead of reactive. So yeah, when they come to me and they're 10 and a half years old and have lived on carprofen for 6 years and 16 other joint supplements and other adjunct medications, we're behind the eight ball. We're going to do the best that we can. And in Synovetin studied that. They said in the really severe cases, 71% of dogs would still be comfortable out to month 12. But in the mild to moderate elbow arthritis study that they had, 92% of dogs were comfortable at month 12. So early finding, early diagnosis, early intervention is really important in these cases. And to me, in my experience, my best outcomes with Synovetin. So let's say we find that 9-month-old, 12-month-old golden retriever or lab comes in, you find elbow dysplasia. My answer to that is go and get surgery, get arthroscopic debridement, do the mechanical changes on the macroscopic level, get that dog into rehab, and then let me address the synovitis with the Synovetin a couple of months later. And I've tracked out a handful, maybe about 10, 12 patients with that. And I'm out year 4 from those dogs, single injection of Synovetin around 4 months post-op. And those dogs are comfortable 4 years later. We didn't have to repeat the injection. So that's my gold standard if I could, but I realize that not everybody finds that, not to can do it for everybody. So we have to find it early is the most important thing. But once you found it, be aggressive about treating it. I think it's another tool. I think it's trying to figure out what are the pet parents' needs and wants. I have some owners that come in and go, yeah, my dog's doing okay, but I don't want taking meds all the time. And I'm like, okay, let's see if we can do better.
I get that. Yeah.
Right. Multimodal is really important. And the research, to me, it's the research. So, we have good research that NSAIDs do good things. That's great. There are no papers on gabapentin showing that it does anything for osteoarthritis. There's one paper on amantadine, really well done paper out of NC State. It's vet school. So we have that. But tramadol, no, we don't have any papers on it. The joint supplements, there's actually papers out now that are, I'm talking like big level papers, systematic reviews and meta-analysis, no longer recommending glucosamine and chondroitin for dogs or cats with OA. But there is good research on things like undenatured type 2 collagen and even eggshell membrane, that those can be good adjunct pieces. So you have to really look at the research, which I could get it as a pet parent can be overwhelming. And even as a general practitioner or a vet tech can be overwhelming. But that's why it's called continuing education. We still keep learning what works in most patients, like finding the things that are there to help support it and not just throwing everything in the kitchen sink at these dogs or cats, because then the pet parents are like, I'm spending 100, 200, 300, 400, 500. Right? I had one dog, granted, it was a big dog, shouldn't have been that big, but he was 120 pounds, should have weighed 80. Family was spending over $400 a month between pills, supplements, and things like that. Like they were spending over $6,000 a year, not in rehab, not in joint injections, but just in the kitchen sink therapy. And the dog was only functioning at a C-. We were able to take that dog, injected him with Synovetin in both of his elbows, and within 4 months got him off 80% of his oral medications. And yeah, he has to get injected every year, but that's still not bad. He goes on like twice a week. He does 3-mile walks on the rail trail with his family at 11 years old. Okay, so that's a win in my book. Now you have to find those, but you need the evidence to support it.
And on that note, I mean, nothing feels better than seeing your patient re-engaged with the things that bring them joy. Pain and mobility impairments can actually erode at that human-animal bond. The parents go out with the younger dog for the 5-mile hike, and then the older dog is at home waiting for them to come back to have his 2 minutes outside. Right. So I think there's a lot to be said for the emotional aspect of this type of treatment as well, or the emotional lives of animals when they feel better like this and can go on that beach walk. It means everything to them, not being left behind, not feeling helpless. So there's a big emotional component to this, I think, as well.
Yeah, that's a huge component, right? Like chronic pain is this quiet, hidden disease, right? It's really easy, unfortunately, to recognize an animal in pain. Go stub your toe, you yelp, you hop around, you're in pain. Acute pain, really easy to see. Chronic pain is the silent killer because, it doesn't get up as much. It's old. I'm sorry. When is age a disease? It's not. The dog that suffers from pain in all of its legs or in its back, and it doesn't want to stand up because it doesn't want to engage in the family. So, there's even a study that showed out of the UK that it was studying dogs with elbow arthritis. 41% of the dogs in the study wound up being euthanized because of their chronic elbow pain. Okay, not from cancer, not from heart failure. That's not why we all got into this. That's not why we have a dog. So, because to me, it's always like trying to find that why, get back to reconnecting that why. What made them happy? What did they used to be able to do that we can do that? And because to me, I always ask, the fun question I always ask people, for those of us that are medically trained, we all get taught that cartilage does not have nerve endings. So why is arthritis painful? It's the synovium. The synovium has all the nerve endings. That's how you know, like there's nerve endings in your knee joint. That's how you know where to put your knee down and how to put your body in motion. There's proprioceptors and nociceptors. So proprioceptors, so you know where your body is in space and time. Nociceptors that detect pain. So if you have all these nerve endings that are firing all the time, you're in chronic pain, but they're firing from every joint. And so just turning down the volume of the pain doesn't solve the chronic inflammation and all the damage. It doesn't reset that teeter-totter that we talked about before, where we have too much breakdown and not enough new cells coming. So turning down the volume of the pain doesn't help the animal. What the key is to get them to reset that teeter-totter where they're making enough cells as they're losing cells. And so that's why like Synovetin that goes in and shaves back that inflamed joint capsule, we're trying to reset to balanced. Arthritis is an immunomodulatory disease. Your local focal immune system, which is built into your synovium, is out of balance. So we're not saying it's like lupus. We're not saying it's rheumatoid arthritis. That's a different that's a true autoimmune disease. But once your synovium gets out of balance, you have to reset the synovium. Otherwise, all you're doing is fighting battles that aren't going to help you.
I'm a bit confused because this sounds great. And you said you've been using it for about 5 years and the results are fantastic. And you're seeing improved function, diminished pain, re-engagement in the family's activities with these dogs and other species. So why haven't we heard about this? What's the prohibitive factor?
So what attracted me to getting Synovetin was I've been injecting joints for 15, almost 20 years. I always looked and said, well, gee, do I have to sedate you twice a year and inject your joints? If we're trying to avoid meds, again, still learning things from our horse colleagues and stuff like that, and even our human colleagues. And when the Synovetin research came around that it was showing efficacy for up to 12 months, I said, okay, this is something I'm really interested in. And so we had to get a radioactive material license. So that takes some time and startup to get that. And so then you have to get the buy-in from the owners and go, okay, where are they at in this cascade, this ebb and flow of arthritis? And do they want to invest in it? Because yes, we have to have our x-rays done ahead of time or our CAT scan done ahead of time. We have to order it, so it has to ship in. And it's only good for 24, 48 hours. So we have to make sure we get it into the patient that day. It's not like we can just use it on another random patient if we haven't screened appropriately. So those are factors into it. But there are more and more treatment centers throughout the United States doing Synovetin injections. Cost-wise, it can be, $3,500 to $4,000 for both joints on the same day. So where is everybody's perception of value is important. Not everybody can do that with their family, and I totally respect that. I think we need to do better about getting pet insurance out there so there's not pre-existing conditions. Every pet that has had pet insurance ahead of time that I've injected Synovetin into, the insurance company has covered that and paid for it. So this is an approved medical device that's getting approved through insurance. It's getting that awareness and getting the fear factor out. Like I said to every family, if we're going to talk about Synovetin, I'm not going to make your pet glow in the dark. I'm not going to give it superpowers. This is different. And sometimes things that are new or different are scary. When you inform and educate, it's also why I've now injected, like I said, over 200 joints. And I've even injected 5 different dogs from 5 different families that were all in various stages of having a baby. They were all from 5 different parts of the DC area. They all went to 5 different OBs. And the fun thing is that the way the rules are written for my radioactive materials license, it's written as if everyone is pregnant 365 days a year. So I said, cool, take the info home, talk to your OB, and come back. And here, give your OB my direct email. I'm happy to chat with them. All 5 OBs, 2 of them emailed me. The other 3 just looked at the info and went, yeah, no, it's fine. It's NRC approved. So those families could all get those pets injected. And then these were able to walk when they could go take the kid out in the stroller after they had their baby. They're like, we can take the dog with us again because the dog's better. So that's super cool. When the pet's injected with Synovetin, everything outside of 3 feet away from their injected joints is completely normal environmental behaviors. So what do I mean by that? Take a measuring tape, measure 3 feet from your dog's elbow, and just draw a circle in 360 degrees. Everything outside of that bubble, you have normal interactions with your dog or cat or Komodo dragon. Inside that, you have some restrictions for a couple of weeks, but those are very practical and they're achievable. So I think we should be doing this more. I think we need more research. I'm working as a team member on 2 different manuscripts that will both be hopefully submitted for publication later this year in 2025, looking at Synovetin. So we're getting more data, independent data coming, looking at efficacy and client feedback and outcomes. So we're trying to learn more as we go.
I want to circle back to the cost. You were talking about that dog earlier that the family was spending $400 a month in supplements that really weren't giving the dog the quality of life that it had post this injection. And they were spending $4,800 for not a great outcome. So I think it's really important that people be educated, that they do the math. Then you mentioned that it is covered by pet insurance if it's not a pre-existing condition. So that's all just fantastic.
As we're wrapping up, can you maybe explain what the process looks like for the pet parent? So what should I expect during and after the procedure? What happens when I drop my 8-year-old pug off with you for the day to get a Synovetin injection?
I'm going to back that up because probably by the day that we're actually injecting your dog with Synovetin, this is going to be at least the 3rd time I've seen your pug. To kind of go backwards a bit, first, it's always going to start with a consultation and physical exam. We're going to make sure we know what joints are painful. We're going to talk about medical history, reactions to different meds. What therapies have you tried before? Do we have any recent imaging? So do we have some x-rays in the last couple of months, or do we need to get new x-rays or maybe a CAT scan? We need to get recent imaging to confirm arthritis, because if we think it's arthritis, but it's actually cancer or it's infection, right? We're setting ourselves up for failure, and that's not what we want to do. So to me, first visit, consult, where does it hurt? Talk about options, maybe change around the pain meds to improve in the meantime. Second visit, imaging. So now we've confirmed it. We know what's going on. Now at that visit, when you come back to pick up your pet or head out the door after imaging, you're going to sit with one of my team members. And so there's like a 10-minute screening process. I like to do it with the family in the hospital. And it's a quick and easy go through, where does your pet sleep at night? When you walk your dog, how close is your dog to you? Do you work from home? Who's in the household, kids, just trying to identify, because this is all the stuff that the Nuclear Regulatory Council, the NRC, requires. And so from that brief survey screening process, we now have a good idea of, is this a good fit for Synovetin for your pet? What restrictions might you be looking at? How you're going to have to modify your environment for a couple of weeks after injection. If that all looks good, then we're going to pick a day, and we're going to say, this is the day we're going to inject the Synovetin, and we're going to order it, and it has to ship in. So that's going to be at least 2 weeks from the day we do the imaging and screening. The earliest we could get it is 2 weeks later. So then you're coming in on that 3rd visit now. Your pet's going to have been fasted, doesn't have breakfast that morning. We're going to place an IV catheter. We're going to do a quick once over, make sure everything's healthy still for anesthesia, sedation. And most of the time, we're going to do these under heavy sedation. So we'll sedate them with intravenous drugs, have an anesthetist monitoring them the whole time, and then we make some very simple shaved areas over, let's say, the elbows, in this case, the inside of each elbow joint. We're going to shave those. Once they're sedated, we're going to sterilely prep them. And then under sterile conditions, I'm going to drop the Synovetin and inject it directly into each problematic joint. We're then going to reverse those sedative drugs or make sure the patient's in a good place, that they wake up, they're comfortable. We're going to usually keep them on all of their oral medications, okay, because the Synovetin doesn't kick in right away. And once they have their feet under them, we're going to send them home that day with those restrictions that we already know, because after we've injected them with Synovetin, I'm going to measure them with a Geiger counter. And now we're going to know, is it 2 weeks or maybe it's a little bit longer, up to 4 weeks of restrictions. And you're going to go home that day and you're going to follow those restrictions and you're going to come back and see me at the end of that restrictive period. And that's the Synovetin process. So I really want to emphasize, and the same thing I do with all the families that come to me to talk about joint injections, is I can do something targeted, right? My team is awesome. I'm super thankful to have my team that helps me to flow through the day to get all of our patients taken care of through sedation and imaging and joint injections. But just because we put something in a joint still doesn't take away from the fact that we have to work multimodal. And that means they stay on their meds for a while those joint injections kick in. But we also have the buy-in that we have to now work in rehab about getting them to improve their range of motion, to walk more, to lose weight, to build muscle. Because the patients that are going to succeed more, right, we're going to have good outcomes, are going to be the ones that achieve those big, broader strokes, right? See the big picture. It's not just about the joint injection. It's about getting back to strength and exercise and fitness. So that's a huge part of this as well.
One question I have is, do you let the pet, the dog, dictate their activities after the procedure?
That's an awesome question too. So they've been sedated. So let's say if they go home on a Wednesday, they're going to go home. We're going to say, hey, you know what? Let them go sleep it off. Sometimes they just want to go home. It's been a long day for them. They can go home. They'll eat dinner a few hours later. If they don't want to eat dinner, I'm okay with that. They all get anti-nausea medications when they come to my hospital for these, because I don't want them being home, car sick or things like that. And then the next day, we're not looking for immediate gratification. Synovetin's going to take a while. So I'll say, get back to your normal baseline walks and then come back and see us in a couple of weeks and start improving that, right? We'll start accelerating those walks, maybe making them longer in duration, not necessarily faster in speed. But now that we start to work on that process, but they're usually going to start feeling better. In my Synovetin experience, the majority of dogs show significant improvement in the first 4 weeks. So I usually say, get home, see where you are next week. Give this time to do what it does. Now, some dogs do feel a lot better much faster. And I think that's probably related to the fact that if I'm putting a needle in to put the Synovetin in, I'm also pulling out the worn out, inflamed joint fluid. And sometimes just getting rid of a lot of that joint fluid makes the dog feel better. So that may be part of it. We just don't know. We can't ask our patients.
So there aren't true activity restrictions, just the education and awareness that it may take a while to kick in. Don't push your dog because of that. And that the dog will likely, logically, if it had been at a baseline activity, return to that immediately after the procedure.
Yeah. Very rarely is a dog going to be sore after any joint injection, but it is possible, and sometimes for a day or two. And that's why most of these dogs that come to see me for Synovetin are already on NSAIDs. So I'm going to leave them on all their meds in case they're sore. And then I'll see them back and we'll say, okay, if you're feeling really good now and you're walking better and they're looking better to my exam and eye, now I may start lowering those medications. But unlike a surgical procedure, we're not going to have them on restrictions for months. We may just go back to your normal baseline thing. If they're a sporting or working dog, that's going to be different. If they're injured and their arthritis is really flaring, I may not have them back to doing their performance things, sport dogs going dock diving, working dogs being police dogs. That's a different timeline. But the average pet, no, we're going to get them back to doing their things, hopefully in the next month.
The initiation of physical rehabilitation, I would think you'd get the most bang for your buck at that point when they start feeling better? Or do you try to get them in immediately to work on that range of motion?
That's another great question. With Synovetin, I want them to go home get through the restricted period for 2 weeks or 4 weeks. So with Synovetin, I want them to go home and follow their restricted activities, right? Their physical restrictions as far as like staying outside of 3 feet from the family or limited interactions inside 3 feet. So we follow those restrictions for those 2 to 4 weeks and then get them into rehab after they've cleared those restrictions. So that's just safety all around. That also is allowed now for the Synovetin to reduce that inflammation in the joint capsule. And now we're setting our rehab team and our patient up for success because now that joint is more comfortable. So we don't need things like laser or shockwave to those joints. And in fact, we shouldn't be doing those because we don't want to upset the Synovetin doing its job. But now you could do those manual therapies, those massage, those stretching, and move into exercise. So that's why I want them in rehab is when the restricted period ends for those patients.
If one of our listeners is interested in pursuing this for their dog or their pet and getting more information, how do they go about that? How do they find these licensed people?
The way to find them is to go on the web. We can put it maybe in the show notes, a link to it. It's called activedognow.com is the Synovetin pet owner website. And you can find a provider there. I think it's always good to have good communication with your veterinary team. And so if you're thinking that Synovetin might be right for your pet, I would say go talk to your primary care about it or go talk to your rehab doctor about it. Because as a Synovetin center, I'm going to need those past medical records, blood work, x-rays, whatever else. So we have to have those good lines of communication open. So I think while you don't necessarily absolutely need a referral, it's great to have good communication across the whole team. And I may inject it ultimately, but if their rehab department is 5 minutes from their house, and that's the rehab department I want working with that pet, so we can be really practical in this multimodal, multi-team approach.
Exactly. Kathy and I always profess the importance of team and checking in with your vet about anything that you're contemplating going forward.
What's your best advice for pet owners considering this treatment?
The key here is if you think your pet is in pain, go find out why. Okay? Go ask, go see your veterinarian, go talk to your veterinary team, and go figure out where it hurts. And then figure out why it hurts. Right? Get the answer. Once in a while, I get a dog sent to me who quote unquote has arthritis and they didn't take x-rays, or maybe the family didn't want to take x-rays. They're trying pain meds and the pain meds weren't making the dog better. And they come to me and they really hurt. And I take an x-ray or a CAT scan and I find a bone tumor. I find bone cancer. So what we think is arthritis, none of us are perfect. And we may think it's arthritis early on, but we can get fooled. So the most important thing is get to a team and figure out why. Because once you know why they hurt and what's uncomfortable, now we can open up all the doors to figure out what the best treatment option is.
And to your point, it could be OA in the beginning. And, you mentioned earlier getting timely, recent diagnostics because it was OA and now there's something, a comorbidity on top of that, like cancer.
Absolutely. And those are rare, but they're possible. So, it may not be very probable, but it's possible. And we need to know why. And I always think that those in vet med have the coolest job in the world because we get to see these amazing animals, to be advocates for them, for their pain when they can't speak for themselves. But that we also get paid to pet pets. Like that's our job. So pet them. Pet your own pet and go, hey, I can bend my elbow. Why can't you bend yours? You hurt. You stop. You hold your breath. You lick your lips. You're showing me that something's not right. And when something's repeatedly not right, we need to figure out why. And if you have a 3 or 4 or 5-year-old dog, that's the equivalent of a 20 to 30-year-old human. Most 20 to 30-year-old humans hopefully are not taking daily pain medications. So if your dog or cat's taking meds every day, then figure out why. And the moment the meds stopped and the limping or the pain comes back, and we're not really solving it. We're just sweeping it under the rug. So get to the why. And I never object to seeing a patient, and this goes for anyone. Mostly it's my working and sporting dogs, but I will gladly see any patient and go, I don't appreciate anything. I think you're actually doing really good. So if you're over worried, come and see somebody and be like, nope, we don't find anything. But on that same regard, like I've had working police dog handlers who come to me who know their dogs, they're with those dogs 24 hours a day, 7 days a week. It's their partner. And when a working police dog comes to me and they go, Doc, the dog's not right, I will spend 3 hours, 4 hours figuring it out, feeling the dog again, watching videos, making them do different functional tests to figure out what's not right. So find a good advocate. That's the most important part of this.
As we've talked today, there don't seem to be many side effects. It doesn't sound like any other comorbidity or disease process, as long as you have the right diagnosis, excludes the use of Synovetin. Is that right? In other words, diabetes, heart disease, etc.
Correct. So like you can have a dog or a cat who has diabetes, Cushing's, hypothyroidism, hyperthyroidism. As long as those other things are under control and they're a good, safe sedation anesthesia patient and they have arthritis, let's figure that out. I think the biggest thing that with any therapy is the non-responders. So if you pull like the original studies for ibuprofen in people, it worked in about 80+% of patients. Didn't work in 100%. The original carprofen studies for dogs worked in about 80+% of patients. So nothing's going to be perfect. Nothing's absolutely going to work every time in every patient. But look at the ones that have the best outcomes, the best, highest probability to do that, and then keep working on other things. Keep working on the why and making sure we get it right.
Well, thank you, Dr. Brunke. This is really informative. And we always close our show with asking where listeners can find more information about Synovetin OA, I guess would be the first thing. And you'd mentioned that there is the website activedognow.com that is the pet parent facing website. And then I think they also have synovetin.com, which is the veterinary facing website. Is that true?
That's correct.
Okay. And then what about you? Where can our listeners find you?
The easiest way to find me is my hospital's website, which is vravet.com. And then from there, you can always get links to our sports medicine and rehab service. And then it's an oldie and I have to still do some updating on it, but I have a blog that is Dr. Brunke. So DRBRUNKE.wordpress.com. That also has contact info and how to find me.
Well, there you have it. Synovetin OA, one easy outpatient treatment up to 1 full year of relief, targeted at inflammation with no side effects. It may sound too good to be true, but as Dr. Brunke's experience shows, it delivers real results. So thank you, Dr. Brunke. This has been very enlightening, and we appreciate your time and coming on the show and sharing your experience with Synovetin OA. Thank you.
So yes, we will definitely put all of that information in the show notes per usual. And once again, just really, really enjoyed our conversation, Dr. Brunke. Thank you so much.
Yes, thank you.
You're welcome.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at Petability Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you and tune in next time.